As the Omicron wave starts to die down in the Philippines, the health department says it's already crafting a transition plan into the endemic phase of COVID-19. But Health Undersecretary Maria Rosario Vergere asserts only the World Health Organization can say when that stage has been reached.
They are the ones studying lahat ng bansa sa buong mundo. Because when we talk about pandemic, it involves all of the countries. No? Marami na sa bansa ang apektado, hindi na lang po basta kanya-kanyang bansa. So usually it's WHO that would say that this would be the end of the pandemic and it's already endemic. It's impossible as for me, no? So the way I look at it, it's impossible for us to declare na tayo endemic kasi yung ibang bansa pandemic pa rin.
The president of the Philippine College of Physicians also believes it's too early to think of COVID-19 as endemic. Dr. Maricar Limpin says Filipinos need to keep their guards up and adhere to minimum public health protocols even as infections drop and restrictions ease.
At this point in time, napakahirap sabihin kagad na malapit na tayo doon sa endemic, no? Matatapos na ang pandemic period o yung era ng pandemya of COVID-19. So, ang pinaka-importante ngayon ay slowly to try to lessen the restriction, pero I hope hindi naman masyadong mabilis ang pag-lessen ng restrictions.
The Philippines is on the right direction as it hopes to enter the endemic stage of COVID-19. That's according to infectious diseases expert Dr. Ronchin Solante. He says although cases are still high, the trend is going down. But he warns the virus will likely continue to mutate, and vaccination is the only key to putting a stop to this.
The variants, the mutation can always be a possibility. And that possibility will now be dictated on how much are we vaccinating the population. Because as long as there will be a segment of the population, especially more segment of the population that are not still protected without any antibody, this population will be the source of the transmission. And you know that this COVID virus, upon transmission to one person to the other, there's a possibility that it can mutate.
Preparations in full swing as the Philippine government's vaccination campaign enters a new phase. Starting Friday, February 4th, pediatric vaccinations will include minors aged 5 to 11. The initial vaccine rollout for that age group will take place in 6 vaccination hubs in Metro Manila. These include the Philippine Heart Center and the Philippine Children's Medical Center.
May registration link, una namin yan ginawa. Pangalawa po, training at saka orientation ng mga vaccination team. Kasi as you know, ibang klase ng dose, mas maliit ito. So dapat po talagang well-trained yung magbibigay ng bakuna.
The COVID-19 vaccination for the 5 to 11 years old age group will be expanded to surrounding provinces on February 7th. The Philippines has already ordered an initial 15 million doses of Pfizer vaccines for the expanded pediatric vaccinations. A government advisor proposes making COVID-19 booster cards a requirement to enter establishments in Metro Manila. But Presidential Advisor for Entrepreneurship Joey Concepcion says if approved, this would not be implemented right away since the region is still rolling out booster shots.
I guess what we're trying to do is continue to maintain that the public who have taken their vaccination, that their immunity continues, no? And whether they get it from COVID or whether they get it from vaccination.